So Julie, over to you.
Thanks, Christy. The Healthy Tasmania 5-year strategic plan, 2022 to 2026, is Tasmania's guide to preventive health planning across various sectors, across government and with communities. And it was launched in March 2022. Marcus is going to share a link to that plan if you haven't seen it. So the plan addresses various focus areas, but importantly, there are also ways of working. So we wanted, as government, we wanted to work differently in this plan in a true partnership with, particularly with communities. So the ways of working helped us to articulate and feedback with what we'd heard through consultation about what was important, include various ways of working. And the ones that I'll highlight are around promoting community decision-making, building capacity, building, using and sharing evidence. So as part of the plan, we committed to improving access to local level health and wellbeing data, really to be able to do that in a way that empowered communities to have a better understanding of what was happening around health and wellbeing, but importantly, to be able to allow them to drive the community-driven decision-making that is important. So in partnership with Seer Data and Analytics, we've initiated a pilot project to create a Healthy Tasmania data platform. And our aim is to provide communities with access to meaningful data, enabling them to share insights, plan effectively, understand their situation, and contribute to the platform through their storytelling and what they know is important in their community. So we're currently piloting the initiative with 5 communities that are receiving the Healthy Tasmania Healthy Together grants. The Healthy Together grants are one of our Healthy Tasmania Fund grant streams, which provide $300,000 to place-based communities over 3 years to help strengthen the local prevention system. And so through this initiative, we're fostering our relationships with partners that extends beyond merely providing the funding. And our goal is to learn alongside community to gain a deeper understanding of government's role in supporting place-based work. And we're also eager to integrate this work with within the Department of Health, and some of my colleagues are here from health planning, which is wonderful to see, but also across Tasmanian Government to be able to enhance the sustainability and provide that coordinated, aligned effort when we look at how we can support place-based action around a range of health and wellbeing issues. Thanks, Christy.
And so it's a fascinating project and it's a very exciting time. Very keen to hear from you, Alison, where you're up to and next steps.
Thanks, Christy, and thanks, Julie. As Julie mentioned, we have been working closely with Seer to help realise our goal of increasing access to data at a local level. Our aim is to enable our Healthy Together communities to use data to inform their planning of their place-based initiatives. What I'm going to share now is how we are keeping community at the centre of this work. I'll be sharing what we have done so far and how we are excited to move to the next phase to truly imagine the capabilities of what Seer platform can offer. Our process will evolve over time through a test and learn approach, and we don't expect it to be perfect at first. And we will continue to shape how we work and the dashboards as we roll them out across each of the communities. What we want to do is focus on developing a data culture within our Healthy Together communities, and we hope that that will facilitate an empowering environment where data is collected locally, valued, used, and shared in a way that supports meaningful, real-time collaborative decision-making. Now, with our work with Seer, we've taken a classic project management approach, including setting up key roles. And my role has been community liaison officer. And we felt this was really important to bring our community partners in early and be ongoing. And we've been very fortunate to have Derwent Valley as our pilot dashboard. And we are building out the rest of the community's dashboards based on what we've learned by working with them. And what's really important from a community point of view and while we will continue to refine this as we work together with each of the communities. As such, we expect all the dashboards will end up looking a little bit different as the project evolves to meet their local needs. For the initial dashboards, and we're going to be sharing those with you today, is we're using data from the Tasmanian Population Health Survey, the Australian Bureau of Statistics, Primary Health Tasmania's Community Health Checks, Jobs and Skills Australia data, and Australian Early Development Census and the Australian Immunisation Register. And these are all available data sets, but we're going to be putting them all in the one place. Being data informed, we know, has its challenges, and it's often limited when the population isn't big enough to show up in data sets as a particular subset of a population. And we have found this when working with the local government area data within Tasmania, the numbers are quite small. And this is where other data sets and like stories will come in and serve as an asset, and they can be added to in replace of or to augment the limited numerical data. We all know that qualitative data is very important because it can help everyone learn so much more about a community in so many rich ways that goes well beyond what numbers and graphs can tell us. And this is where we're going to be heading with the next phase of our project. And we're just going to show a bit of a demonstration now, and I'm going to hand over to Belinda, who's going to run through what our platform is looking like at the moment. And yeah, that's going to be exciting to look at. Thanks.
Thanks so much, Alison. I've loved working on this project, and I'm really excited to show you the dashboards today. So let's first of all make sure that I can share my screens with you. So just one moment. Can everybody see that okay? Yeah, wonderful. Working in collaboration with the Healthy Tasmania team and community, Seer Data has built a comprehensive Healthy Tasmania data hub that's tailored to meet the diverse needs of different communities in Tasmania. There are 7 areas of interest, including 6 wellbeing themes, 60 indicators, and 7 data sets. Data for the 5 different Healthy Together communities can be explored from here. Today, we're going to dive into the Derwent Valley Community Dashboard. From the different areas of interest, we'll select the Derwent Valley Health Wellbeing theme, as it includes data from both the 2022 Tasmania Population Health Survey and Community Health Checks. These 2 data sets have been democratised for community use for the very first time, so I'm excited to show them today. The dashboard is very much community-led. It's up to the communities themselves to select the various images, stories, and indicators to support the most insightful, data-driven storytelling. The community data is shared alongside state data for Tasmania. This is done where possible. You can see Derwent Valley is represented in the blue and Tasmania in the green. So let's just take a moment to celebrate this particular really positive story here. Derwent Valley residents aged 65 years and older are well engaged in physical activity. 87% who were surveyed in the 2022 Tasmania Population Health Survey met the national target for moderate to vigorous activity, notably more than the residents of the same age group for the whole of Tasmania at 73%. Not that it's a competition, but for the 18 to 64-year-olds, Derwent Valley and Tasmania had similar results. On the other hand, data can be used to highlight health challenges. If we look at the data for Derwent Valley residents, only 17% of those surveyed reported that they ate the recommended daily intake of fruit, while survey results for Tasmania at the state level show a more positive story at 35%. This is an example of where the data can be used to assess and help tailor activities to improve health and reduce health inequities. If we scroll down past all the other indicators for health that Derwent Valley chose to include in this dashboard, daily alcohol consumption, smoking, chronic health conditions, emergency department encounters. At the bottom of the dashboard, an Explore Data button links to the full range of health insights that are associated with the health wellbeing theme. These insights are the building blocks for what is displayed on the dashboard. It's up to each community to select some of these insights and decide which ones they want to highlight. You can click on each of these insights to find more detailed contextual information and also data tables. As I mentioned earlier, there are 6 wellbeing themes, 60 indicators, and 7 data sets. The other themes include financial security, inner wellbeing and mental health, social connection and inclusion, our children and young people, and natural and built environment. These themes include a number of indicators that help the community answer questions around food security, life satisfaction, child immunisation rates, and much, much more. In addition, to augment these themes, we can find key demographics and statistics about the Derwent Valley population if we click on Who Lives in Our Community. Charts display data for Derwent Valley alongside both Tasmania and Australia. Here we discover information about an increasingly diverse population. For example, as represented in this chart, many people in the community speak a language other than English at home, increasing in Derwent Valley from 1.3% in 2011 to 1.6% in 2016, and then jumping to 2.3% in 2021. To see what number of people this might represent, we can head down to this metric chart here, and that's 250 people who speak a language other than English at home in the 2021 census data. Down the bottom of this tab here, we have, again, the Explore Data. This button takes us to the full range of demographic insights where you can explore more about the population of Derwent Valley. Overall, the Healthy Tasmania Data Hub aims to enable a community-led, data-driven approach that's essential for the successful implementation of the Healthy Tasmania strategy. Thanks so much. I'll hand back to Christy now. Thanks.
Thanks so much. And thanks, Belinda. It's exciting to see all of it come together, and really interested to hear from your perspective, Danielle, the value of this work and your... Sorry. So over to you.
Thank you, Christy. It is really exciting actually to see that, Belinda, and you spoke through it so well. So yeah, for the community of the Derwent Valley, and working on this project with Healthy Tas and Seer has been really important for us to be, as Alison said, engaged really early on. You know, really part of the decision making around what is best for our community and what the look and feel of the platform is, so that it's more accessible, I suppose, for the people in our community. We've just developed this social profile. So we've spent the last 12 months looking at data and social profile through our Healthy Tas grant, the Lift Local grant. And we didn't know we were going to be a Healthy Together community or a chosen to share the Seer platform first. So we'd done a lot of this deep dive into Derwent Valley health and wellbeing, as we didn't have a social profile, and we wanted to better understand the really local levers, I suppose, and needs of the community to have a baseline so that we could look at what we needed to move forward to improve the health and wellbeing of community. So it's been really a great opportunity to have this platform arrive really at the same time as this health and wellbeing social profile. And you'll notice if you look at this profile that we've tried to keep the look and feel of the Seer dashboard very similar. We worked really hard with the social profile document to make sure that the document shared local images that weren't of tourists or the tourist attractions that so often the Derwent Valley is known for, but really engaging with locals, you know, wood cutting and running in the park and fishing and paddling on the river. So we also wanted to keep the data, I think Alison alluded to the data being stripped back almost to be the basics around what we wanted to share, because sometimes the data, you need to be able to read it across a number of platforms to better understand the impacts for community. So even though when we were developing this, we had a lot of data and a lot of the data that Seer's using as well, for us, the importance was making it really accessible and straightforward and accessible to everyone, so that community can be part of the change around health and wellbeing, and informing governments, local and state, around what their priority areas are moving forward. The benefit of the Seer platform for us is it's given us the opportunity to test and learn as it's been developed. And as I said, it's really been community-based. We've been able to use this document and embed it. So we've got a digital platform that's very similar to a paper-based document that will be used, I think, differently, even though they're very similar in data. Obviously, with the Seer platform, it's live, and we have the ability to upload local stories and data to that to keep it really relevant. As we all know, as soon as you gather data, it's almost out of date. So, and also I think that, as Alison talked about, in a small community, it's really difficult to drill down to postcodes or smaller towns, and then also the keeping people's personal data safe in terms of sharing stories. So we're part of this social profile. We spoke to 20 community champions and asked them to ask questions of their local communities around 5 social determinants of health. And so this gave us another picture that brings pretty good data, or clear data, that we can share in terms of stories on the Seer platform. And obviously, when we're working in community and we're working with, for example, young people or young Indigenous people, we can start to hear things that the data just won't collect, and the kind of layering up of impacts around, for example, housing or lack of education or disability or chronic illness. So the stories are really powerful, and this, as we've heard, gives us a really clear platform for sharing those stories that aren't captured in data tables. I think we've asked the questions around, the Seer platform is building on this existing work, and who is it for? We want this data to be for community, to be engaged in making decisions about priority areas for them. For some people in our community who are isolated, it might be, about social connection. And we also have heard access to food. So food's a really big issue. And when we start to look at some of the impacts of lack of access to food, as Belinda shared, it then contributes obviously to health and wellbeing as we age, as well as general wellbeing and potentially chronic illness. So this gives us a platform to really share with local data with local community. For us, it's really important that this platform is owned by the community. As Julie and Alison spoke about, it's a very different way of working in the community. And I think this platform pairing with the grant, the Healthy Together grant, really gives the community a new way of thinking about the way we work together, and not a hierarchy of structure, but really an engagement across all levels of government, and in engaging and putting community at the lead and the front of any decisions made, and giving them a role, offering community a role around what can they offer for change, or what do they need to step up and be part of the systems change that needs to happen. So yeah, in that we're looking at a really strong community voice, and I suppose part of this social profile development, we speaking to 20 community champions who you ask those questions of 10 to 20 of their peers. It's offered us an opportunity to hear stories from people who would never talk to local government or state government necessarily, because it's not a survey. It was really empowering for those community members to engage with their peers and families and communities around some things that maybe don't get talked about in community, those social determinants of health, and the reflection on how things might be able to change with some levers. And obviously the data doesn't lie, as I said in my bio, and that's been really important for us to kind of ask the questions around, there's all these local services, but why is our data, for example, in the under 5 age group going backwards? I think the Seer platform will give the community confidence, certainly organisations, to be on the same page around data. Like I think often people don't know where to start, or they're busy in their day. But I think having this resource to be able to kind of step back, to step forward in an informed way and together as a community is really important and empowering for our community. So we're really looking forward to this platform being live and available for community, and I suppose walking through it with community and making sure that people hold it as their own data and story, and hopefully have impact on the changes that can come from that. So thank you.
Thanks so much, Danielle, and so many fascinating insights there around hierarchy, collaboration, community owning the story and the decision making. Really exciting to hear that from you.
Thank you.
Before we go into the open discussion, because I'm sure many people have a number of questions and considerations, and we also have some of our wonderful clients and customers here from across Australia to share some of their insights as well. Before I open up to the panel, I just wanted to invite you now, Alison, to talk about some of the learnings so far.
Thanks, Christy. And as we've heard Danielle speak, you can hear all the insights that we've learnt from her. And I'm probably going to be sharing this summary, a little bit of what we've learned from working with Derwent Valley in this next little part before we head into the discussion. Just to sort of share that stood out as the most important for us to consider in this work. Leverage, where there's an appreciation of data or data skills that a community partner may have that will support that community to build a data-driven culture within the collaborative group. And Danielle and her team have been a fine example of that. And if you feel it's missing, ask what you can do to build it. And this is very important if we are wanting communities to take ownership down the track. Appreciating the time with design, and in our case, encouraging like that local imagery and colour choices and organising the data in a way that the community wants it to be. And Belinda has been fantastic to work with to be able to sort of realise that, and the team at Seer. So that's been really good that's been acknowledged. And using a strengths-based framing in the narrative that helps explains the data, which is really important. And continue to ask what can be removed. And at the moment, there's lots of insights in there. And down the track, we may work with the community to some of those insights might be removed from the dashboard and only sit, back underneath. Because sometimes too much data can make the dashboards look too complex, and it can be really harmful because people don't understand, and it can be a barrier. And question whether the indicator that can be influenced at a local level, and if its inclusion may actually create a deficit thinking and may cause harm or stigma as well. So that's something that we need to consider down the track as well. And what's been really important for us is to go at a speed that everyone is comfortable with, to allow reflection and to acknowledge the capacity of our partners who are managing their day-to-day work to try and work with us on this project. And most importantly, I think we've all found that we've been challenged in our thinking about data by our community partners, and I think that's something that we all need to sort of appreciate, the fact that we are continuing learning. And I've got the next slide. No, I think we've got the next slide. Yeah, what's coming. So what we're doing next is we're going to be working alongside our communities to plan their work locally, but at the same time we want to refine and build out their dashboards further with the data sense-making process. And as I said, this will expect each of the dashboards may end up looking quite different. And also, what are the things we think is really important to consider for this work ahead? And after this, we want to hear from you what you might want to tell us about you might be thinking is really important from your experience. For us, we really feel we need to understand more about each community situation, their concerns, their aspirations for the community. Is the indicator or theme that we're looking to act around useful to understand the issues locally? What data is missing? And whose lives they hope to improve? Who's going to benefit from the work and who's going to miss out? And when we do bring everyone together for this data sense-making process that we're planning, we will expect to have a diverse range of people from different backgrounds, different parts of the community, different organisations, and those with lived experience. So we expect the interpretations of the data will be nuanced because we all have our own bias. We have pre-existing knowledge. We even have desires about things we want to act around. But being able to step back and take that broad systems view and relook at the situation is what we're aiming for. We know we're in the initial stages of this work and we've got a long way to go in terms of putting the dashboards out with each community of what they're actually going to appreciate and use. But we're trying to align ourselves with Seer because they prioritise community data ownership, and that's something that we really are aligning with. And so I suppose what we really want to learn from others is what do we really need to do to create that local ownership of dashboards so that they are used in an ongoing way and in a meaningful way for community. Thanks, Christy. You're happy to run the discussion panel part now.
Thanks, Alison. Yes. And just before I do that, I think we just launched the other poll to get a perspective from people who are here to help understand what's most important from your perspective, everyone in the audience, to enable communities to use data to support planning and decision making. So if you could take a moment just to answer that poll, and we'll come back. Then we'll open up for the panel. And as I said, we've got some of our wonderful customers and collaborators on here today, including Melanie Olf from Gladstone Region Together, who has been working as a community leader, data leader, and measurement, evaluation and learning leader for many years in Gladstone. And I think we'll be able to shed some light on some of those questions as well that you just asked, Alison. So thank you so much, everyone. I can see we've got most people having answered the poll now. So if you don't mind, perhaps, Angus, ending that poll and we'll see the results. All right, so one of the important elements that we're hearing is all of the above, not surprising, I suppose, but one of the key things is sense making. Then once we have all the data, and I think, you know, Danielle, you spoke about that a moment ago, how do you enable and support community ownership and sense making of the data and insights? And then there's also the important element of collecting and sharing stories to build the community narrative that, you know, that is a critically important component, the narrative, the storytelling that sits alongside some of the insights that you're seeing in the data. So I'll stop that share now, and I will invite people, if you're happy to turn on your video, and we'll have a conversation around, you know, how do we enable community ownership? That question that you just asked a moment ago, Alison. So I guess, as I mentioned a moment ago, I do have Melanie here. I think, Melanie, would you be happy to come?
Hi, I am here. Thanks, Christy.
Hello. Yeah, so
Hi.
be really keen to hear your perspectives, and I guess maybe you could spotlight Melanie.
Sure.
Hello.
Hi. Thanks for the intro. We've also just launched a new look Gladstone Region Wellbeing Data Hub here up in Queensland. It's a lot more interactive, and we have now embedded elements of qualitative data as well. So it tells more of a rich rolling story of our community. So we've got these beautiful new icons that we've embedded above graphs that some are community voice, sector insights and research. So as we're out doing our community engagement and hearing particular feedback from community, or also getting sector insights from particular services, we're then uploading that in these beautiful icons above graphs, so that when the community has a look at the data, they can also sort of hover over those and see what community is saying as well and what services are saying. So it triangulates the data, and it's sort of, you know, telling that beautiful comprehensive story about our region. Yeah, it seems to be working really well. We've had really great feedback so far.
So Melanie, because you've been on a journey for a couple of years now, how did you go about building data skills and data understanding and sense making in the community?
Yeah, so we've actually ran a couple of workshops to build data capacity, and we also created a Data 101 terminology resource, because we found even when we were working with community, some of us who work closely with data, we almost have like a special data lingo, and community were looking at us very, you know, oddly, and not even understanding what some of the basic terminology, things like LGA or SA2, or, you know, when we're talking about qualitative and quantitative data, and, you know, even that kind of terminology, which seemed very foreign to some of our community. So we created a resource in PDF format, and then also did some work around workshopping that with community, and then have also been doing a sort of a separate piece with service providers around building their data capacity and walking alongside them in their data journey as well.
Yeah, that makes a lot of sense. Danielle, I was just curious about your thoughts and what you're thinking, how you're thinking about that engagement.
Yeah, so when we started developing the social profile, we were looking at having agency voice and community reflection as well. But we really, in terms of the resources we had and the time, really wanted to strip it right back, as this is our kind of first attempt at a social profile. So I think, Melanie, what you're doing is fantastic, and maybe that is a step in the right direction for us into the future. So yeah, for us, it's really about taking the stories and the data back to community who are engaged in that story collection and that social profile, and engaging with them. And I'm guessing we'll hear the same kind of issues around understanding language and lingo that's related to data, and then developing what's needed. So we literacy is low in our community, so we might need to be quite creative around how we make that happen. But yeah, the first step is to take the document and the data back to the community who are engaged, and then start to step that out further. And really, we've got 12,000 people in our community, so it's not massive. So it gives us a really good opportunity to engage with a lot of people through workshops or kitchen table conversations, or whatever that might be, to engage with the community around the next steps forward around health and wellbeing.
Thanks, Danielle. So I've got a number of questions here coming through on chat, and thanks, Melanie, for sharing the Data Hub. It's exciting to see it go live. It's fantastic. Sky's asking, Melanie, the Data 101 resource, is that something that is public and that you would be able to share?
Yes, I have just put the link up to our landing page. So from that page that I've just shared, you can access the Data Hub, but you can also then we've created a Data Hub guide to be able to help users navigate our new Data Hub. And then there's also a link to the terminology resource as well.
Thank you. There was a question here, Leah, about downloading the dashboard as a complete or customizable report. So it's shareable as a digital report, and you can download insights and data tables but not as an actual PDF at this stage. You can print parts of it, but it's designed as an interactive and report, and it can be embedded on a website. And then, as I think we heard from Alison and also Danielle, over time, some of that, the key information on the landing pages will be customized based on what community wants. And then I think, as you were just speaking about, adding that community voice and story, Danielle, to those interactive reports will be the next phase. There's a question here from Kate. Hello, Kate, and thanks for joining. Is the potential for community data portals to support a formalised, community-driven collective impact approach part of the thinking, and are we supporting this direction? I think this is probably a question for you, Julie. So reframing how I'm interpreting this question, Kate, please let me know. I hope this is correct. is this potential for Healthy Tasmania to continue to share and enable collective impact, community-driven decision-making with data as one of the tools?
Absolutely is the short answer. That's the whole intention of the Healthy Together grants, and there we see this data tool as a way to help achieve that. But in and of itself, I think it's still got that potential, because as you look at data, you see it's really about stimulating questions, and people will have different perspectives of what the data is saying, and then it'll lead to what's missing, and then who's missing at our table, and how do we get those people involved. So we actually think it's, while we're in early days in terms of its potential, that's our vision for it. Alison, I don't know if you have anything you would like to add to.
Yeah, no, Julie, it is. It's certainly part of the process of being able to have those conversations, as I said before, with different partners who might be part of that group locally. Identify there might be something, an insight or something that we're talking about, but the person that might have the most ability to change at a systems level may not be present at the table there. And so how do we bring that person in? How do we use that information that's on the dashboards to be able to share progress and what's happening? And that might invite people to be part of it, to build that collaborative work that we're hoping, and decision making as part of the place-based work we're doing. Because at the moment, most of the communities are still planning what they're wanting to do next, and are hoping that this data will be a way for them to be able to engage, not in their collaborative, but also understand where the action needs to be taken or could be taken.
Thanks, Alison. There's a great question here.
Can I just add to that?
Yeah, please do.
Sorry. I mentioned before, I think for us, the data in the social profile, but obviously the data on the in the Seer platform will continue to engage in community asking questions. So I mentioned, you know, in all the childcare services and all the services in the Valley, that we've got a beautiful child and health clinic. We've got great after school, you know, some after school care, but you know, there's a whole lot of things, play groups and stuff. But still, our under 5 data is going backwards. And what the social profile has done has brought intelligent people who know what's in the Valley, who know about working collaboratively, to ask that question about what's failing. And it's not necessarily about more money. It's about looking at, we think it's about looking at culture and inviting people in, or being in their place rather than inviting them in. So it might not be more money. It's more around asking the questions, as Alison says, and filling the gaps with what we have. Or asking the questions and filling the gaps with community rather than doing it with. So it's already got our community thinking about, this isn't good enough, that at the under 5s data is going backwards, but everyone's been looking at the great stuff that's in community, which is important. But when that's not meeting the needs of and the change in that data, there's something missing, and we need to do more with that.
Yeah, thank you, Danielle.
Thank you.
Really great question here, or comment here from Jess. How can health NGOs contribute their data? We hold very good data that could inform prevention planning. Triangulating this data can be very powerful to plan collective impact and systems change initiatives. Maybe a question for you, Julie or Alison?
I'll hand over to you, Alison.
Oh, yeah. I mean, we, as part of this initial data we've put into the dashboards, is on data that we know about, we have access to as government, or what we can work with. And as you know, we don't have access to the like NGO data. And so part of the next conversations is working with the partners locally. How can we leverage that, the opportunities we've got there to be able to include that data within each of the individual communities' data dashboards. And we are able to provide some support to work with you to, you know, make sure that data is shared in a way that's protecting that sort of privacy, data sovereignty, and all that kind of important stuff, to be able to have that data available and part of all the other data that we've got there as well. So it's going to be a real mixed message, because we know, as one of the questions we asked, we know there's data missing, and we want to be able to add that. And this is the actual the beauty of this platform, is that we can do that. So yeah, we're excited to be able to bring that data into part of the conversations for this place-based work. So we look forward to that next step.
And I think that is obviously part of the maturity for communities when they're ready. I mean, Melanie, if you're still there, I think that certainly already in Gladstone, those conversations with service providers are underway to bring in that local data that aligns to some of the priorities of the community in Gladstone. If you wanted to share any more on that, Mel?
Yeah, we've had an interesting journey with local service data. We had great momentum last year where a lot of services were jumping on board and wanting to share data. But what we saw happen was a lot of staff turnover, which then impacts those partnerships, because we felt we put in so much hard work sort of building partnerships and getting data sharing agreements in place, and helping services along their sort of data journey. And then staff turnover, had big impacts where we found, certain managers or frontline workers might leave, and then we were kind of having to, circle back and start building those partnerships again and building that trust with new people in those services. So it's certainly a work in progress, but obviously those relationships are so integral to that data sharing with services.
Thanks, Mel. Is there anything you wanted to add, Danielle, before I go to the next question? No? Kathy has asked a question around consideration for sharing learnings across communities of what does and doesn't work to achieve the outcomes they're seeing. So Julie and Alison, do you want to share a little bit about your thinking there?
Yes, so in the context of this particular pilot, we're sharing those learnings across the 5 Healthy Together communities. There'll be we've only just started seeing how that might look, asking the communities what they'd like, but it does seem like there's an appetite to have a communication across those 5 different communities, because things will roll out in different ways and there'll be different learning. We are also, as part of our evaluation of the Healthy Tasmania strategy, we're doing a deep dive into 2 of those communities to understand how the Healthy Together grant has been adding value, if at all, and some of the supports in place, like this data work, will be part of that. And there will be some broader evaluation of asking the 5 communities how things have gone in terms of this particular pilot, whether the data platform actually has done what we were hoping to do. And that's part of what we'll be hoping to present in 6 months' time as well. So I'm sure there's going to be rich learnings from each of those communities that we can sort of share.
Thanks, Julie. If anyone has any questions, please drop them in. It's quite a love seeing, thanks, Rob, bottom-up community-based data initiatives. Is the final aim to also inform some place-based policies and funding?
Yes, that's also part of what we're hoping. And we're, in terms of the data dashboard, we're hoping that there's opportunities through the development of the wellbeing framework, which is a broad government commitment, that we will see bottom up meet top down, and we have organised some of this data into some of the domains that came out of the wellbeing framework. So as that work rolls out, hopefully we can see a connection there, and hopefully then that will start to allow communities to be able to plan and advocate for the things that are missing from a policy perspective, and government hopefully will see that come out of the data and what it's telling us and what it isn't telling us as well.
Thanks, Julie. A great comment here from Samara. Thanks, Samara. The relationship and trust building is crucial. Data asymmetry is an emerging power dynamic, and you spoke to it a moment ago, Danielle, and I think you've also seen it in real in practice, Melanie, because it's a power dynamic that helps or can help potentially to enable community-led decision-making and that nexus of government and community. Danielle, do you want to speak a little bit more about that from your perspective? And then I'm going to ask you, Mel, you know, your experience of that as well.
In our community, trust, I mean, in all communities, trust is important, but it seems that in our community, there's been a lot of people come and go, community not being asked for input. And you hear, and I've heard this from the kids, you know, as well as other communities. So they've never been asked, what do you want in your town, or what do you want your playground to look like? So it is very much about building trust, and it shouldn't be personality based. It should be based on, you know, systems and policies and strategies that are local government, state and federal, that are all committed to hearing that voice. I suppose what I hear in a small community is finding those champions and really trusting and building on their skills, and then inviting them to contribute. And, you know, people are busy in community. People aren't necessarily time rich. So, and it's often the biggest champions who have their fingers in all the pies in a small community. So being really aware of that and not overburdening, but absolutely being transparent and open and authentic in that engagement is vital for change. You know, what we've learned in the last 18 months is to be consistent and show up and show what we're going to do together, not come in and do it for people and tell them later how it's going to look. So, yeah, absolutely. And I think what we've learned is, you know, we now have a number of people who would never put their hand up for engaging before will, you know, they say now, how can I help, or what can I lead on, or I don't know how to lead, but how can I support? So, yeah, crucial. And I'm sure Melanie's found the same in terms of, you know, that community work and finding champions who, in small towns, it's your reputation. They'll talk if they don't trust you, you know about it.
Yeah, absolutely echo everything that you just said, Danielle. We've had to do the same, really harness sort of our key community champions here in Gladstone as well, and they've played that real pivotal role, I guess, in role modeling the courage, you know, to be involved and make it seem possible for others. We're sort of doing two different pieces of work to build that trust. We're in the stages of developing a data and evaluation working group locally. So bringing together some of those key local data champions. And the idea is that we'll meet every quarter, so that any new data that we have coming in, that group will help us, you know, come together and think of things like our data sovereignty and you know, help us interpret that data and make sense of it and provide those insights. So we're hoping that will be a success. And then also with our New Look Data Hub, where we're embedding those sector insights and community voice as well. We feel that sort of, particularly with services, it's almost like that soft entry where, you know, we're you know, encouraging services to share their, you know, their experiences from a qualitative point of view, almost like an invisible data hub club, so that we hope, you know, that will build their confidence and comfort in sharing sort of their feedback that way, that then in the hope, you know, in the future, they'll be more comfortable then to share their quantitative stats as well in our data hub. So we're trying two different approaches, but yeah, absolutely key champions all the way.
Thank you. I've only got a couple of minutes left. I want to give a shout out to Samara, who's put a link in the chat on how I'm interpreting it. And my quick view is a great tool for data collection, community data collection. So Samara, I'll be in touch to see if we can integrate into that and look at how we might bring all of that data together. As some of you know, the Seer platform is a data catalog sharing platform where we can collect all types of data and share data for a community-led decision-making and storytelling. So I'm really delighted to see the work that you're doing, and congrats. Is there any other questions from anyone in the group before I wrap? I guess, what's the link for the hub from Jess? Sorry, Jess, do you mean it's not public right now because the data hub is now being shared with all the communities, and the communities are working on how they want to use that and curate and finalize that for their own community, and they will be available as the community makes those available. I understand that's the case, Danielle and Julie and Alison. So we're at time. Thank you very much, everyone, for being with us today. Incredibly insightful conversation. So just a heads up that part 2 of this webinar, the next part of the story, we'll be scheduling, I think, in March. I just need to double check on those dates, where we can share with you how things are progressing and update everybody on the learnings and the next steps as well. So thank you very much for Julie, Alison, Belinda, Danielle. Thank you so much, Mel, for sharing all of your amazing insights and all of the work. Congratulations, everyone, and look forward to the next phase.
Thanks so much.